Welcome to Wound Care Matters podcast, brought to you by Medique UK. Join us as we take a deep dive into the world of wound care. Welcome to our new podcast, Wound Care Matters, where we'll be discussing the chronic skin condition known as hidradenitis suppurativa with our special guest, Suzanne Maloney. I'm Sharon Gardner, Clinical Services Manager for Medique UK, and I'm really pleased to have Suzanne here with us today. Suzanne is a hidradenitis suppurativa advocate and founder of HydraMed Solutions, who have created HydraWear. Hidradenitis suppurativa, also known as HS, is a chronic and debilitating skin condition that causes recurrent inflamed, painful lumps to form in the skin. It can have a really significant impact on a person's quality of life, both physically and emotionally. In this episode, we'll be diving into the challenges of living with HS, the importance of raising awareness about the condition, and the resources that are available to support those affected by it. We hope to provide valuable insights and information to help those with HS feel less alone and more empowered in managing their condition independently. So sit back, relax, and join us as we explore the world of HS with Suzanne Maloney. So thanks for joining us, Suzanne. It's really good to have you here. So can you tell us a little bit about your experience with HS and how it's impacted your life?
Yeah. So my story starts when I was just a child, actually. I was about 12 or 13 when I started to experience strange lumps in around my bikini line. I didn't really know what was going on. And, you know, you're going through puberty and your body's changing so much anyway. So it's an awkward age. So I was really embarrassed about them. They would come and they would kind of rupture and resolve and recur. But I hid this from my family because I was just too ashamed. And that's very common. It's very common in HS patients to hide their symptoms for a long time. But like a lot of patients, it progressively worsened. And it got so bad when I was 17, I told my mum, and she brought me straight to the doctor. And the doctor, unfortunately, wasn't, I suppose, aware of the disease and treated me for a skin infection. And this was the treatment, I suppose, journey for me over the next few years, where I would get a flare up of these lesions and lumps, and then I would go to the doctor, I'd get antibiotics, it would resolve a little bit and it would come back. So this was kind of a cycle for the following few years until eventually I had a particularly bad flare and I had to go to the emergency department. The GP thought I had cellulitis, but it was actually just a really bad flare of HS, but I wasn't diagnosed yet. So I had an emergency surgery, and then the lesions after that, they started to kind of spread to other areas of my body. They started moving around to my kind of perianal area, up into my armpits. And, you know, I was distraught. I was going to the GP every couple of months at this stage. And I was referred then to a colorectal surgery because of the location of some of the lesions. The GP thought I might have cutaneous Crohn's. So I was seen by a colorectal surgeon, and he actually ruled that out, but was baffled as to why this kept happening to me. And he did 3 or 4 surgeries on me, and then eventually looked into it in more detail about my symptoms. And he finally diagnosed me with hidradenitis suppurativa when I was 23. So it was 10 years or more or longer, slightly over 10 years from my first symptom to receiving a diagnosis. And receiving a diagnosis is really bittersweet because throughout those 10 years, I had done so much to try and figure out myself what was happening. I'd done all sorts of crazy diets and gone to homeopathy practitioners and acupuncture and all sorts of anything that I could do that I thought was going to help me. I tried. So I spent a lot of time and energy and effort and money trying to help these symptoms resolve because I was very desperate, to be perfectly honest. It's really debilitating. It's incredibly embarrassing, and it gets in the way of your life from the moment you wake up. But when I was diagnosed, you finally have a name for it. So you're relieved and you're like, okay, we'll be able to treat this now. We'll have a plan. But then you find out that it's incurable, and the only real treatment options are, surgery or biologics, which are effective for some patients. And that you'll kind of spend the rest of your life living with this disease and managing it to a certain degree. So yeah, it's kind of it's difficult mentally to accept something like this because you don't want it. It's grotesque. It's painful. It really can cripple you sometimes, and accepting it is certainly a challenge for a lot of patients, including myself.
Yeah, I'm sure. And obviously, there are so many people out there, aren't there, that are suffering, with what you've described. Obviously, you talk about that time in your life, that 10 years, coming into contact with multiple different kind of medical professionals. And can you talk a little bit about that? What kind of, how were you kind of approached by them? How did you feel in coming into contact with those different professionals?
Yeah, like obviously these lesions are on very intimate parts of your body, first of all. So as a young woman or a teenage girl, it's really embarrassing. I've had some really good experiences and some really nice experiences and some really awful ones. I suppose I would primarily have gone to my GP practice, but there would be a kind of a rotation of different locums in the GP. So I wasn't seeing the same doctor every time. So there was no one really there to say, hang on, she's back again, same symptoms. When you actually look at my medical history, it's so obvious what I had.
Yeah.
But no one was able to join the dots. I was when I was in college then, there was a women's health clinic attached to our college. So I went there instead of my usual GP, and I was told actually that I had an STI, which I didn't, and I was actually thought it could have been an STI when I was a kid as well, even though it was, you hear these things and you're learning about these things and you don't know what's going on with your body. I remember one particular experience that will stay with me forever. I had a lesion. I'd had a lot of surgeries at this point around my perineum, my perianal area, and my genitals, my labia, and so I have a lot of scar tissue there, and it's very tender anyway. But I got a new flare up, and I have been diagnosed at this stage. I had a flare up that was like, those party balloons that you make animals with, those kind of long party balloons. Yes. So it was like one of them going from my coccyx right up to my labia. Like it was like a blown up condom almost. It was kind of very swollen, very painful, excruciating. And when you're experiencing a flare, sometimes you can tolerate them and sometimes you can't. And this one got so bad. I was actually taking a hot bath every couple of hours to try and get it to come to a head, but because there's so much scar tissue, there was nowhere for it to open. There's no natural opening in my skin for it to that I could see anyway. So I got into the bath and I had my bath, and then I stayed in the bath after the water drained, and I actually got a mirror and a blade, and I was like so desperate that I was actually about to cut my own skin, my own labia open.
Oh, wow.
Because I was in so much agony. I was so distraught, and I just didn't know what else to do. And the only thing that stopped me doing it was the fact that there was so much scar tissue. I couldn't actually figure out where to do it. And I'm so glad I didn't in hindsight, because it's such a dangerous thing to do. And, I would be advising people not to do it. But it's such a common thing in HS that patients get to that stage where they're just so desperate for relief because you're in so much pain that you would actually take a blade to your own genital. Like, it's crazy. Yeah. So anyway, after that, I got out of the bath. I didn't do it. I called my mum, and she came over and took me over then to the emergency department. And this experience was horrendous because I was really basically dismissed. The doctor that saw me told me that it was just inflammation. There's nothing there. He can't see anything. He gave me some paracetamol, and I was just like, I can't leave here. I'm sorry. I'm I don't know what I'm going to do, but I'm just traumatized here. Please help me. He ended up giving me kind of codeine then. I think he thought that I was actually seeking pain medication. I wasn't. I was genuinely in a very bad way. But he sent me home anyway. He wasn't able to do anything for me. He told me it's just swollen. There's nothing in there that needs to be drained. It's just an inflammation, and it will resolve. So the next day, I called my dermatologist actually, and I told them that I have to be seen. I need to be seen. And when I was in the reception waiting for that appointment, they were very obliging, in fairness. And when I was in the reception waiting, I felt a wetness in my underpants, and I knew that it had started to open. So I sat there and I said, okay, well, at least I have a bit of relief. And then I went in and I had my consultation, and the dermatologist was draining that lesion for probably 5 minutes, 3 to 5 minutes. And it went from being like this thick kind of exudate to blood, and then to like a lot of serous fluid then afterwards. And it was just phenomenal how much exudate came out of it, but also just so shocking. And I don't know, that experience really traumatized me. I think I'll never forget it. I've had a few other kind of post-surgical experiences, because these surgeries are quite big. They remove quite a large area of the skin and margins outside of the area, and you're left with pretty big substantial wounds, and pretty much to your own devices a lot of the time. And there's been a lot of learning and a lot of, I suppose, yeah, that probably did contribute to the development of Hydrowear, was having to be so self-sufficient and to figure out, how am I going to keep these dressings on my labia and on my inner thigh, and get up out of the bed. There'd be days after some of the surgeries where I just made a toga out of a bed sheet and just walked around my house in a toga because I couldn't put a dressing on. So it's just horrific. But there's some really good experiences as well. And I have to say, the doctors who know about HS and who treat HS for the most part are incredibly compassionate, and the nursing community as well have really started to embrace this as something that needs to be addressed very urgently and very seriously. So yeah, there's a lot more good than bad, but unfortunately the bad experiences tend to stick
with you, don't they? And they're the things that have an impact on you. And obviously now, as you said, and obviously listening to your examples of how you kind of your condition developed and how you kind of came to live with your condition, learn about your condition yourself, it must have been emotionally challenging for you and your family around you. But you talked about some interesting diet choices, some things that you tried. What do you think some of the misconceptions are around HS? Because I think that's really important, certainly when we think about obviously the age that you were, when you started with symptoms.
There's a lot, and there is a lot of evidence that suggests like smoking and obesity are linked to HS. But I think the misconception here is that it's the cause and it's the patient's fault, that they have done this to themselves by being overweight or by smoking. I was a child. I've always had a very healthy BMI. I've actually probably sometimes been a bit too skinny, if anything. And I didn't smoke when I was a child. I've had the odd cigarette throughout my life, but I'm not a smoker. And I think one of the biggest misconceptions is that if you're not obese and you don't smoke, it couldn't possibly be HS that you have here, because smoking and obesity are so heavily intertwined with HS. So it's something that I would just be, I suppose, mindful of. If you do see these symptoms, just because the patient isn't obese or doesn't smoke, it doesn't mean it's not HS. I also think a lot of patients possibly gain weight because of the disease, because it's so painful. It also has a huge impact on your mental health, your motivation to even get up and leave the house some days. It's really physically debilitating and emotionally crippling sometimes. So I think there is a bit of a vicious cycle of weight gain in some cases that is due to the disease and not the cause of the disease. I've also heard a lot of patients say to me that, or had a lot of patients say to me that they were told it's a hygiene issue. They need to wash more. They have this because they don't wash. They have this because they pick their nose and touch their skin. They have this because it's an STI and they've contracted it. And they're, I suppose, really stigmatizing things to say to people, especially people with HS. We already have very, low body confidence, poor body image, low self-esteem, and we're suffering enough. It really is. And sorry, I'm laughing, but that's probably how I cope with things. Like, it really is incredibly hard, especially when you're flaring and you're oozing all of this exudate, and to get up out of bed and put on your gym clothes and say, right, I'm going to go to the gym. For me, in my life, I used to love playing Rangers and softball, and I was really sporty. I was quite athletic when I was a kid. That all went out the window. I used to swim a lot. I stopped playing team sports because I became a really unreliable team member. I was always like, sorry, I'm missing practice here. I can't miss, or I can't go to this game. I've have a surgery. I've missed half a season. And so you lose little parts of your life that other people might not think are that important, but they are important. And you lose the ability to pick the clothes that you love sometimes because you can't wear, I can't wear my leather jeans, and it sounds so trivial, but it actually is, when things kind of get stripped away from you because of the disease. I can understand, and I have experienced just this lack of motivation. I'm not interested. I'm just going to watch Netflix. So I can see how there's such high rates of depression, anxiety, and mental health disorders, and increased suicide rates in HS patients.
And I think those things, aren't they, with HS and other sort of long-term or chronic conditions, they're the things that people who don't suffer with those conditions take for granted, like being able to just go in the wardrobe and get the pair of pants you want to wear, or being able to go and do activities with your friends in your social circle. So, it is, you say it's small things, but it's not, because it has such an impact on you. And that kind of brings me on to my next point, really, because, this isn't the first time we've met. We've met, a few times before, and you are a massively passionate person, and you are very passionate about HS, the HS community, and very motivated. How do you keep that? How do you keep that going? How do you keep that positivity despite everything that you've been through?
Yeah, I definitely, I've definitely been on a journey with this. I'm not always, positive. I think turning the suffering and pain into a reason to change things really keeps me going, and knowing that I'm helping people, or potentially helping a younger person be diagnosed quicker so they don't have to experience this, really helps me mentally. We get a lot of feedback from parents and patients, and like people using our products, just saying how much it's changed their life. So I love that. I love getting that. That really keeps me going. But in my general day to day, there's definitely days where if I am sick and I'm not able to do anything, I just kind of give myself the time now to go back to bed, or, I'm taking the day off sick. It doesn't happen that often, but you have to do it and not feel guilty about it. Because I think a lot of people, even people like in general without HS, you feel bad about taking a day off work, but you have to give yourself the time. So I try to do that guilt-free. And I try not to push myself too much if I know that it's going to be bad for my health. I also try and put things into perspective, because when you're in the middle of a bad flare, like the time in the bath, there was actually a second time in the bath that was pretty bad as well. I do take a lot of salt baths when I'm flaring. So if I'm having a bad time, my water usage goes through the roof, because I will be in the bathtub a lot, because it does soothe me. Yeah, it does kind of give me relief. So I try to, when that's my coping mechanism. I'll be like, okay, painkillers, ASAP, whether I get them from the doctor or just over the counter stuff, into the bath, self-care basically,
Yeah.
lots of rest. And I also try to put it into perspective of the whole year, because I might get a really bad flare a couple of times a year, and I always just have to remind myself, like, this will be over soon and you'll be able to go out for a walk. And I actually do try and go out for little walks anyway. So yeah, I just keep trying to, sometimes I'll even mark on a calendar, okay, this was a bad day, that was a bad day. And then when you look back, you're like, actually, in the bigger scheme of things, I only had 5 bad days in the last 3 months. That's not that bad. So
Yeah.
you just have to keep reminding yourself, this will be over soon. You'll start to feel better in a few days, and just kind of focus on maintaining yourself until you start to feel better.
Yeah.
That works for me. It might not
Yeah.
work for everyone, but it works for me.
Good.
I've also got great family and friends and fairness around me, you know, and I have a great support network of other patients too. And I definitely use the patient groups as a way to vent sometimes, to give out, so sick of this disease,
Mm.
or to get advice sometimes too.
And are those patient groups easy for other patients to find? You know, so maybe if someone's not aware of the patient groups, how would they go about accessing that kind of support?
Yeah, there's a few that I can send you the links to, and we can add to the notes of this. There is an emerging HS UK group that actually runs online or in-person meetings every month. That's an amazing network to have. There's also a HS Ireland group that it's on Facebook. It's a community. There's a lot of closed communities on Facebook that are great. So you just need to go online and, look it up. And then in the US, there's other ones, but we'll focus mainly on UK, Ireland for this. So yeah, there is, and they are easy to access, and people in them are also patients, so they know what you're going through. And I would really heavily recommend or strongly recommend joining one or suggesting to your patients, if you're seeing HS patients, just mention it to them that there is, there's lots of, they're not alone, and there's lots of other people out there who can offer some advice.
And I think that helps, doesn't it?
Oh, completely. Yeah.
So tell me about HydroWare, because we've mentioned HydroWare a couple of times.
Yeah. So I suppose a bit more background of the treatments that you go through as a patient, all the surgeries and lots of different antibiotics, medicines, injections, like intralesional steroid injections. I'd IV ertapenem at one stage, where I had a PICC line, and there was a nurse coming to my house in the mornings and the evenings for weeks, And that there's the treatment, there's the medical treatment, and then there's the surgical treatment. But there was nothing for me to just live my life with. I really struggled with the daily wound care of my HS. And especially, as a young woman, I was just kind of in college, and then I was starting my first job, starting my career, going out with a guy, wanted to go on weekend breaks, or, going over to Paris, or, just kind of the usual
Just
stuff
life,
that you
life
do.
thing.
Exactly.
Yeah.
And this kind of wound care challenge was always with me. I was like, how am I going to do this? I'm wearing a white uniform, for example, in work, or, I want to go on an airplane and not be concerned about dressing, or it was just always so hard. Nothing would stay in place. I used loads of adhesives to kind of tape up my arms and my shoulders and across my chest. I'd be wrapping my legs, I'd be like a mummy in bandages or with loads of tape. And the tape, obviously, when you're using it over and over again in the same area, starts to rip your skin away. And I suffered really badly with this skin stripping and rashes. And you'd find yourself then repositioning a dressing at a different angle the next day to see if it doesn't overlap too much with the burn, the previous rash.
Trying to find some nice skin.
Exactly. And I'd always had an idea then to create this solution for people like me. For me, it started off with, I want something that I can use. And then I started talking to other patients in the groups to find out, how are you all dealing with this, or what do you do? And everyone was just like, it's such a nightmare. The overwhelming feedback was, this is a huge problem for people with HS, and people are cobbling together all sorts of over-the-counter stuff, tape, sanitary towels, kitchen paper. There was one lady using socks from the dollar store. She was in America. She just bought socks because they were so cheap, and she just kind of stuffed them into her clothes. I was like, this is not acceptable in like this day and age when we can do so much.
Yeah.
And it just started a kind of a something in my brain that was like, you have to pursue this very seriously. And then I was at my friend's hen party, and I was shaking her mother-in-law's hand, and my dressing fell out of my top from my armpit onto the ground. And that was kind of the real turning point. That's when I said, okay, that's it. Like, just make some or like do some emails or do some research and find out who can help you with this. And that kind of started me on this journey back in, oh my gosh, 2018. So Hydrowear is essentially, sorry, it was a very long introduction to Hydrowear, but it's basically, yeah. And, you know, we've since published the research that we did with patients on the impact of wound care and what they're using, and, you know, how often they're doing dressing changes. And it's just such a big part of your day.
Yeah.
That it is important to get it right.
Yeah.
Because you can change someone's life by giving them the right tools to manage their disease at home as well. HS patients are young for the most part, and we're kind of in the prime of our lives, and, you know, we want to be productive members of society, and being able to address the wound care challenge is a big part of that. So it started with the crop top, because my armpits were really like bad at this stage, and I was like, I need something for the armpit. So I started looking at ways to keep it in place. And the crop top, the design has changed a little bit from the original kind of idea, but not too far. It's basically there are a range of medical garments that have perforated pattern over the treatment area. So in the groin, the armpit, the buttocks, and for the men, kind of underneath in the scrotum area. And the perforations serve as a way to secure the dressing to the garment without needing to adhere it to your skin. So you put the dressings come in two parts then. There's the actual dressing pad, and each dressing comes with a fastening tab, either one or two, depending on the size of the dressing. And you put the dressing inside the garment, and you make sure that it's visible through the perforations in the garment. And then you take the fastening tab and you stick it, you stick the fastening tab to the dressing through the holes from the outside of the garment. I don't know if I'm explaining that. It's very hard to explain. Okay, good. It's actually like, so you're making a little sandwich with a fastener, garment, dressing, instead of sticking it to your skin. And you can change your dressing in 10, 20 seconds, depending on, you know, how quick you are. And the beauty is there's no adhesive. So when you're in work, you can just pop into the bathroom, take the dressing out and replace it really quickly. You don't need to be fumbling around with scissors and tape and anything like that. So it saves a lot of time, and it's very easy, and it's not painful. And that's the biggest thing for me, was the pain, because HS is already a very painful disease. And when you're applying your own dressings and removing your own dressings, it's like this horrific self-inflicted pain that you have to do, and you know you have to do, and the alternative is just to shove rags and like socks and, you know, non-adhesive things into the area and kind of hope they don't fall out, or don't leave your house. You know, wear your toga around the house,
wrap up in your sheet.
Exactly. So it's kind of, that's the thing for me, was the pain. It's so painless. It's amazing.
Yeah.
So yeah, that's Hydrowear.
Brilliant. And I think it's really important that we say, obviously, you've talked about the base layers or the garments, you know, they come in different styles. You've got your unisex, your female, your male, and obviously you've mentioned dressings. And it's important that if any patients or clinicians are listening to this, that both items are prescribed. So dressings and the garments, and making sure that they've got it as a whole system, really, because that's how it's designed to work.
Exactly, it's a system. And
Yeah.
the typical patient uses about 2 dressings per day. And that's actually a lot less, like of the hydrowear dressings. It's a lot less than other kind of gauzes. And, if you're using a gauze, you're changing that so frequently because, they're just not absorbent and they kind of move around and they have all those little like filaments, those kind of little fluffy bits and stuff, you're kind of just,
Yeah.
and they're very smelly as well. So there is an actual kind of single-use dressing saving here as well in terms of the environment as well, which I quite like too.
Yeah, brilliant. So finally, if there's one kind of message, word of advice, or, just something that you'd want to share with people who may be suffering with HS or actually maybe listening thinking, that's me, I have those symptoms and I didn't know. Is there anything that you'd want to get out to those people or their families?
Yeah, I would say definitely consider it could be HS and go to your doctor and bring some information with you, some reliable information, not just anything off the internet. Like there's a lot of very credible and well constructed information online about HS. The British Association of Dermatologists, for example, have some good stuff. The British Dermatology Nursing Group have a great consensus document. I'd actually recommend that because it shows the kind of the treatment pathway of the different clinicians patients should see, the different provisions that should be made for patients and what patients need to be successfully treated. I think that's a phenomenal document. So bring this information with you, and I would say advocate for yourself. In hindsight, I wish I hadn't left that A&E that time. I wish I had kind of said, no, I'm like pushed for something else because I was very debilitating, and there was a bit of a risk of sepsis there as well, and an infection. Looking back on it, I wish I'd kind of stood up for myself a bit more. I'm not saying to go and be bullish or anything, but just, come with information and don't allow yourself to be dismissed because, a diagnosis is really important. And I would say also try and keep track of your symptoms so that when you actually go to the doctor, they have the full picture. Because a lot of the time, if you are waiting for an appointment, by the time you get to see the doctor, it might actually be resolved and you might have nothing to show them. So maybe take a picture of what you're going through, write down, I was in pain today. I give it a score of 6 out of 10. It was stabbing, it was aching, describe your symptoms and keep a diary so that they understand what you're actually going through and how frequently it happens and how long it lasts for. And yeah, I think just get support and don't be embarrassed or ashamed. It's nothing to be embarrassed about. It's a disease. It's like any other disease. You don't see people with cancer being embarrassed about it or, I don't know, like COVID. Well, maybe back in the early days, but you don't have people with the flu saying, "Oh, I'm so embarrassed to have the flu. I can't tell anyone." It's a disease.
Yeah.
It's not your fault. You didn't cause it. So definitely seek medical treatment and mental health support if you need it, and peer-to-peer kind of support as well is really helpful.
Absolutely. And hindsight, it's a wonderful thing, isn't it? But hopefully it can help somebody else.
Absolutely, yeah.
So
completely.
thank you so much for your time. As always, I could listen to you all day. I love speaking to you and hearing about it. So thank you for your time. Obviously, this has been Wound Care Matters podcast by Medit UK, and it's been a pleasure as always.
Thanks a million.